Hello. I'm back again with another scan update. I have scans today. I have a PET scan. Today is, I don't even know what day it is. Let's see, the 29th of January. I have to get a PET scan today. I had my bone scan and stuff in December, but I think my oncologist is just thinking, we'll do the PET scan now to cover everything, and then in 3 months, because I should be getting scanned every 3 months, we'll go back to doing the bone scan plus CT thing that we were doing before. I'm actually like not feeling good about these scans. I feel like something's gonna show up. The only thing that I'm holding on to is that I have been wrong about feeling bad about scans before. I've never been wrong about feeling good about scans. So like maybe things will all be fine still, but I'm not feeling very good about them for a few reasons. One, because I've got this stuff going on under my right arm that, like, after my lymph node surgery there.
Mommy.
Hi. What you doing?
You taking to the camera?
Yeah, I'm talking to the camera. Is it okay if I talk to the camera?
Yeah.
For a little bit?
Yeah.
Okay. I've got this stuff going on under my arm after my lymph node surgery. Since then, I've like had checkups and they've checked it and they've never been concerned with what's going on under there. So they think that like it's other reasons causing what I'm feeling, like the lumps and stuff. But I don't know, for some reason I just feel like they're wrong. Well, that's the main reason. I think that something could show up in lymph nodes, and I don't think it's going to be anything that's like a huge deal, but I do feel like something will show up that's new. And then the other thing is that after my mastectomy, I like am feeling a little bit of stuff like on the chest, and that is kind of changing a lot because of the surgery, so that could be absolutely nothing at all. But like before I had my mastectomy, I had like this feeling whenever I would walk around, I could like kind of feel like, it's really hard to explain. I could feel like a little pain while I was walking around before my mastectomy, and that was like the cancer, like the lump of the cancer that was there. And after I had my mastectomy, I stopped feeling that. It just like felt like there was like this whole weight off my chest. And I now am like kind of starting to feel that again when I walk around, but it's like hard to tell if that's just because, you know, I've recovered so much from the surgery that now I'm actually like noticing there's like a little bit of pain there. Because before, like maybe I was in so much pain, or like I wasn't in tons of pain, but maybe like I was in pain after the surgery and I didn't really notice that there was like one spot that was hurting more than the other spots. So like that could also be nothing at all, but it just like, you know, make me worried a little bit, because, you know, once you have cancer, you're just kind of always thinking like, what if this is something, what if that is something. You can't have anything wrong with you without you thinking it's cancer. You can't just like start having back pain and then being like, oh well, maybe it's from this, or neck pain, and then I'm like, no, it could be cancer, because last time, one of the other times that I had this pain and I thought, oh, it's just from doing this, it was actually cancer. And then the third thing that's been going on is I've been having all of this hip pain in my right hip, and it's the same hip that was radiated back in September. So maybe it's just post-radiation pain. I don't really know. After we got back from the cruise is really when I started noticing that pain. So like a lot of this stuff has really gotten worse like since the cruise, or like on the cruise is when I was noticing the lymph nodes under the arm. But I've had it checked since then. I had it checked like a few weeks ago, and they said it was fine. I've also just kind of been feeling disgusting. I've had like this cough, and like I just keep getting these low fevers. I kept getting like a fever of 100 Fahrenheit. I don't know what that is in Celsius, so look that up, I guess. You playing harmonica?
Yeah.
That's very beautiful. You're very good at harmonica. Yeah, so I got these fevers of like 100, in the mornings and at night, but I would just take one Advil and then it would go away. And then I had all this neck pain with those fevers and all of the joint pain here. I've also been increasing my dose of my Xylota. My oncologist had me starting off with 3 in the morning, 3 pills in the morning and 3 pills at night. But then I moved up to 3 in the morning and 4 at night, and then I moved up to 3 in the morning on days 1, 3, 5, and 7, and 4 in the morning on days 2, 4, and 6, and 4 at night. So actually, I think I even started lower than 3 and 3. I could have been doing like 2 or 1. I don't even know. I don't remember. That's some great harmonica playing, let me tell you. Yeah. Anyway, maybe that's the reason for my side effects of like the joint pain, or I don't know if that causes, like Xylota causes joint pain. I'm also thinking Xgeva could have something to do with like bone joint pain, because that's like a bone drug. So it could be so many different things, but like, of course, one of the things it could be is just that there's cancer. So that's kind of why I'm feeling like something's going to show up on this scan in some place somewhere that's new. And I'm worried about what that means. Does that mean like another treatment change? But I'm probably getting way too far ahead of myself right now, and I just need to go get the scan. I'm actually like so happy that it's scan day finally, because that means I can finally relax and just get the scan done and know the results. Like, I don't really, like, as long as I know the results, I'm going to be fine. Like, it makes me feel so much better if I just know what's going on. I hate the build-up to scan day. It stresses me out. It stresses my husband out, like, probably more than me. And I try not to think about it until, like, the day before, but I think I've probably been thinking about it for the past 5 days this time around. So I think I've like built up a lot of like worry about this day, and which is why I'm not like really feeling as good as I was last time, because before my bone scan and my brain MRI, I was feeling like everything was going to be perfectly clear, and it was. And I'm not trying to be too negative here, but this is what I truly think. So I'm just sharing that here with you now. I'll give you an update when I know more. Hello, it's the next day. So I'll tell you what happened with the scan. It wasn't very good. Wasn't very good at all. It was kind of all of the places that I thought there might be something plus more. So that's not fun. So I did have cancer on the lymph nodes under my arm, like I expected. A little bit in the right breast. I had some stuff in my lungs, which explains my cough. And then had stuff through the bones, which I'm not sure if it correlates to my hip pain or not, because I really, like, it's only been a day, so I haven't, you know, talked to them about exactly where the bone mets are, but maybe it has to do with it. And there was some stuff in my liver, and then various other like lymph nodes and stuff. So it's safe to say that the treatment that I'm on isn't working, and we're going to start a new one. So today I just got out of an echocardiogram, because the treatment that I'm going to start is it has like a 12 to 20% chance of affecting your heart. So we will like track that. So I needed an echocardiogram to just have like a baseline of everything. It's cold, so that's why I'm coughing more. Later today, I have an education appointment about the drug that I'm getting, and honestly, I do not remember the name of it, and I thought about it last night and was like, I don't remember the name. Maybe I should ask him what the name of it is. But then I was like, you know what? No, I'm just coming in today anyway, so I'll just talk to them about it then. But he gave me multiple options. My oncologist gave me multiple options on what to do. And the one that he and the other 2 doctors that he consulted with thought was the best option was this medication that I'm going to switch onto. And the medication is kind of a targeted therapy for HER2 breast cancer, like HER2 positive. But my breast cancer isn't just like regular positive. Mine is HER2 low, so this one is like has been shown to work well also in patients that are only HER2 low and not just like HER2 positive. I don't know if you say like absolute positive, like I don't know. We'll see how it works. My oncologist said that we will be checking, and since I've got these like spots in the lymph nodes and spots in the breast, we can track those spots to kind of gauge how well the treatment is working. And he said that we would notice results in like 6 weeks if it's working, and that he normally does scans every 3 months, but if he would move it up to 2 months after my last one if like there was concern for that. Because he gave me 3 options, that means that there's 2 other options that are like kind of there if we want to go with those later. Somebody just looked at me like, what are you doing? And so there is kind of a backup plan, stuff that is like immunotherapy, chemotherapy type things. And this is a treatment that's, I guess it has like, they explained it to me, but the easiest way for me to explain it is that it's kind of a targeted therapy that targets like the HER2 receptor and stuff. So hopefully it works well, and my oncologist said that he's seen it work super well and just like clear everything up for even patients that he's had that were HER2 low. So just hoping that it works. But yeah, just trust that, me and my doctors and my family, we're all working together to try to get me the best care possible. And I know it might seem like, somebody that did something and they got better and whatever, but that's their case and this is my case, and every cancer case is different. And yeah, just gonna keep doing the best we can here. And scan was super discouraging and didn't like to hear those results, but here we are, one day at a time. And I guess I may or may not give an update after my education appointment to explain more about the drug and the side effects. But I should be starting treatment soon. Starting treatment in February. I'm starting it Monday. It's Thursday. I'm starting it Monday. So they're getting me in as fast as possible. I appreciate the urgency, and we're just gonna see what happens. Okay, bye.